Sit down. Thank you. Thank you. Thank you. Okay. Welcome everyone to our wonderful dialogue this morning with an American hero, and I'm very proud to say a Texas hero. I'm sure if any of you were awake or alive, you might have seen Judge Clay Jenkins talking about what was happening in Dallas when Mr. Duncan, during and after his hospitalization, and he was a major, I don't know if you saw him, but you should look up the videos about him. He was a major influence on calming the public, on giving them accurate information, and managing this, well, it was a terror, at least in many people's minds, a great threat at the time. And we are so honored to have him come here and talk to us about how did he manage privacy facing this threat of an Ebola epidemic. And I thought I'm going to get out of his way and let him tell us about what happened, how it happened, and what are the lessons learned, and then we'll let you all ask questions. But he was just such a hero because of his humanity, the way that he treated the family of the person with Ebola, the way that he talked to the residents of Dallas and really the nation. And so, Clay, you want to tell your story? How did it happen? What happened? And
well, Deborah, thank you for having me here, and thank all of you for what you do to protect patient privacy and people's privacy in general. It is so important. It is quintessential to our democracy that people have a zone of privacy and that their expectations of privacy are respected. We've seen unprecedented infringements in people's privacy just over the last few years, and we need people who will speak up for privacy, and you're doing that. And I think the term of American hero is not one we should throw around too freely, but I think you are heroic in what you're doing, and I want to thank all of you. Thank you, Deborah, for your work and for having me here. Let me preface explaining what a Dallas County judge is. It's a unique thing to Texas.
Of course.
So I'm not a judge. I don't wear a robe, and I don't preside over people's court cases. It's a vestige of the Old West, where the person who was in the highest elected official in a county was called the judge, and that allowed the judge to do things like hang people in the old days, and settle all sorts of disputes, and run a budget, and basically, run the town or run the county. And Texas is a strong county system. We have strong city managers for cities, what we call weak mayors, and we have some great mayors, but the power rests in the city manager. And then at the county level, there's an elected manager, and that's what I am. And so when matters of public health come about, the person who oversees that is the county judge. In large urban counties, and Dallas County is 2.5 million people, the county judge also serves as the director of emergency management, and I have other duties that are unique to the large area as well. So I was blessed in this situation to already have a pretty close relationship with the CDC. In 2012, we lost 19 people to the nation's worst West Nile virus epidemic. Mm-hmm. And it caused me to declare a state of emergency, to bring in airplanes, and to spray the entire county of Dallas with the CDC's help. Embedded in that team from the CDC that came down to help with that were Dave Daigle and Lyle Peterson, two names that somebody may want to jot down. Dave Daigle is, I think, the senior person for public relations or public information at CDC. Lyle Peterson, I believe, is still assigned to the White House. He is the lead person on infectious disease for the CDC. After that, Tom Frieden, who runs the CDC, and I had gotten to know each other, as we taught the model for West Nile virus in 13 after doing that in 12. And so that was good that we knew each other. My first knowledge of Ebola, and do I have any of my federal partners here? Any federal partners? Anybody? Good, let's talk about them. No, I'm kidding. My first knowledge was the day of, was the Tuesday. I can't remember the exact date. It was a Tuesday, and we got the test back. I called up to Washington. I think actually the first thing I did was call someone I knew in the White House who said they're putting together a CDC team. Your friend Dave will be on it, and we'll be there, you know, at 9 o'clock, and y'all can all have dinner and figure this out. But the CDC is gonna take lead, and West Nile virus I had taken lead, and so I felt pretty reassured about that because I didn't know anything about Ebola. I hadn't seen the Dustin Hoffman film or anything, and so they came down. The next day we had a meeting with Governor Perry, who, by the way, is, strangely enough, while I'm doing this, he's announcing for president, I think, simultaneously. But we had a meeting, and it was some congressmen and the mayor of Dallas, who I worked very closely with, and it was very, very clear that we had a disconnect between members of the team on the execution level, on the disease trace level. And nobody's doing anything wrong. There was just a real disconnect as to statutorily who was in charge and how we shared information. And so that was a real concern to me and Dr. David Lakey, who's also a name you should write down, who cares very much about privacy. David was the top health official in Texas at the time. He is now a professor at UT, and would be a wonderful person to work with on these issues, and dealt closely. He and I officed together at my EOC through this ordeal and was instrumental in the privacy issues. And so Tom Fried and David Lakey and myself had a phone call a couple hours after this meeting because we were all very concerned with the joint communications that appeared to not be set up. So to my shock, they told me that we should probably start an incident command structure, for those of you who know emergency management, and I should be in charge of that. And I pushed back on that and said, well, David, you're a doctor. Tom, you're a doctor. And I didn't even stay in a Holiday Inn Express, and I don't know if I should do this. But the idea that they had, and I think it's a good one, I think one of the things that we learned is local control works very well in these situations. Is people will trust you. They know you. They don't know us. And that would be true, I think, even if you had a place with 100,000 people. Probably even more so, because in a place with 100,000 people, people would literally know one another. People know me from television largely, or radio, or print, but they know me, and they didn't know Tom, and they didn't know David. And your first response is also important because the first responders, the hospital CEOs, the others, they needed to know who was in charge. Amazingly enough, normally when we have an incident command structure, we have what's called incident command in a box. And it's what it sounds like. You open it up, it tells you exactly what to do, you run a checklist. That didn't exist for Ebola. And so David and I literally on a whiteboard that night in my emergency operations center wrote it out on a whiteboard, which is never the way you want to deal with an emergency. But the things that we wrote out on the first night were securing Louise Troe. The man who died, his name is Eric Duncan. His fiance's name is Louise Troe. There are 3 young men who are minors. I won't say their names, but securing Louise and the minors into a safer place than where they were. And we wanted to do that. We wanted to check on our trace. At that time, we thought that the disease trace was going to be contacts of Eric Duncan. Later, we found out it was mainly in the medical community with the contacts who had PPE or personal protective gear on, but the protocols would change literally like every 6 hours during this. The protocols would change. So the early PPEs were not complete, and the early protocols for disinfection were clearly not working for us. And we didn't know that at the time. We made a privacy decision, a very controversial one, the very first night, and that was we had a situation, and I'm not sure we made the right decision. I'll tell you that. But we made a decision the very first night because the information I was getting, I wasn't able to go to see Louise that night. It was too big of a mess, really, at that time for me to do that. But the information that we were getting from our state partners was that Louise and the children were non-compliant and were continuing to go to school, although we had requested that they not go to school, and that therefore they weren't there to get their temperatures taken, which in Ebola it's very important to get a regular temperature reading at regular times, because people begin to get a temperature before the onset of symptoms, and you want to isolate them and get them the care they need if that temperature begins to go up. And so a decision was made to do an order to keep them in the apartment until we could move them. The next day, you saw on CNN, if anyone remembers, the the unintended consequences of that order. Almost immediately, you're fighting two things in any emergency. Right now, I've got a state of an emergency going on at home right now, a flood, and so you're flooding, and I've lost 6 citizens to the flooding. So you're fighting two things always. You're fighting the underlying cause, and you're fighting fear. So our first responder community immediately wanted to know the names of every contact trace. But by that night, Dr. Kumar, who's another great guy that you may want to talk to at some point, who headed up the CDC's team before Lyle got there on the disease trace, he and Wendy Chung who was the county's epidemiologist, had come up with 117 people that we were tracing. And so the first responder community, and some of those people, let me back up and explain this. Dallas County is urban. There's only 6,000 people that don't live in a city. It's just 100,000 or 200,000 person first ring suburb after another surrounding a 1.2 million person city. And you can't even tell when you leave one and go to the next. The surrounding counties allow people to have more yards, and so a lot of people that work in Dallas live in these surrounding counties. There's about 7 million people in the whole metropolitan area. So the first responders in the surrounding counties, the first responders in my community said, well, Judge, we want to know where these people are. And the way that works in Dallas County is I consider people's request and then give them basically a decision. And my decision was no. You don't need to know that, because a contact of a contact can't get you sick, and we're not going to have news cameras outside of people's house because they rode in the same ambulance with Eric Duncan. And we already had a problem, I think, as Deborah and I were talking about yesterday, that despite the fact that the protocols are that we just talk about patient 0, we had this man's name, Eric Duncan. I had the district attorney go on the news and say that he was looking into prosecuting Mr. Duncan because he believed that Mr. Duncan might have known that he had Ebola coming over here and might have lied on some paperwork to come here, and therefore might need to be prosecuted for risking other people's lives. Now, he and I were close friends, and I was able to talk to him about that, and he backed away from that position, but that would not have occurred had we kept Mr. Duncan's health information private. And so as Mr. Duncan struggled for his life, we had these other things going on. We had people within my own government. So the county judge is similar to a mayor and a city council. You got commissioners. Each commissioner has about 675,000 residents that they see, and there's 4 of them. They all wanted a release. They wanted a list of these people's names, right? And then, of course, as you're doing your disease contact trace, a few people would fall off, but mostly because we're trying to get a complete picture, we're adding to that list. So that list swelled up to about 300 people, at one time. We were able to drop those people off pretty quick, but it swelled up pretty big. What we ended up coming up with, which I think is a national model, and I'll send you all the law which just passed in Texas, because we came up with this, and I'll be honest with you, we didn't have a law at the time. This is one of the few times there was a lot of tension that's been reported. I don't want to talk too much about it because it is kind of, I don't like to talk about what's happening inside the EOC, but the Vanity Fair, some people have talked about it. Some of the embedded reporters from the New York Times have talked about it. Governor Perry and I didn't always see eye to eye. Governor Perry was a great partner during this. The law in Texas puts me in charge, puts him in a secondary role, but he was a great partner. And we didn't always see eye to eye on these privacy issues, particularly when it came to the first responders. And so in an effort to resolve that, what we came up with was I would enter an order. I've got some very broad powers in an emergency to allow the name only of the person to be, and their address to be embedded by up to 3 people at for each city. They're in their IT department could embed them if we had a person. So for instance, in the town of Plano in Collin County, they gave us the names of the people who would know the health information. They would know Judy Smith, age 49, the last 4 digits of her social, and her address. We would put that in their system. It would ping their system if there was, say, a domestic violence call or a medical emergency at Miss Smith's house. And then that's the only way the first responder would know. So if he didn't have to go to Miss Smith's house, he would never know that she was there. And that balance with the first responders, I finally got comfortable with it. My executive staff was pretty much apoplectic because we were about to have a mutiny amongst the first responder community. But I got comfortable with it because I realized when you're dealing with an emergency, your first responders are kind of like your family, right? And you need to give them enough information to keep them from being so afraid. I mean, I had grown people crying, grown men crying to me because they were worried that these are people that run through doors on SWAT teams, but they were afraid that they would take home Ebola and infect their children. And that's not possible. But it's very hard for people to take my word or even the word of the CDC doctors and the EOC. So that was done, and now that is the law in Texas and a model that will probably be used. A lot of misinformation goes out in these situations. So with Louise, I got a host of information. We could not find anyone to take Louise and move her into a home outside of this dirty apartment. So I went to her apartment to apologize to her at night, and I had been told that there was illegal activity, that perhaps this was a house of prostitution, all sorts of misinformation. And so when I went in, the night before, you may have seen us move her in a truck, but the night before that I went in to apologize because we couldn't move her. And what I saw was a woman sleeping on a couch cushion with a blanket from the Salvation Army on the floor in a dirty apartment. All the furniture had been moved into one bedroom. The 3 young men were sleeping in the other bedroom. The only thing left in the whole house was a picture of Jesus praying in the garden. And I talked to her for about 10 minutes, and it was very easy for me to see this was a person with dignity and with an incredible amount of grace, dealing with an untenable situation, and afraid and horribly disrespected. When I walked in the door, floodlights from 300 yards away, from news cameras, flooded the door. The 13-year-old had to put a towel over his head to open the door because he didn't want to be seen by those cameras. And it gives you an idea of the sort of breach of privacy that these situations can have. I think the lessons learned from this, the takeaway was we had 2 nurses get sick. Some of their private information spilled out. There's actually there's been a lot of lawsuits. that have been settled against the hospital. There's still one pending by one nurse who is upset because her allegation in the lawsuit is that she was filmed again without her knowledge and consent while in a state of fighting Ebola by one of her caregivers, and also the workplace safety issues with getting Ebola in the first place. I don't want to comment too much on the lawsuit. I really can't do that, but you get very close to these people, and I do love that nurse very much. And I love the other nurse, and I love Louise and those three young men and all the people who worked on this. So I wish them all the best. But I think what we learn from this is words really matter. Leaders, and you're all leaders, leaders can either set the table for reason and compassion, or they can incite fear and anger and panic. Ultimately, the community is the one that responds, but it's very important how you set the tone for that. When in doubt, follow the science. If the science is, public health and infectious disease, follow that. Anytime you hear a leader say they're doing something out of an abundance of caution, they're screwing up. That's what that means. Okay. You don't do things out of abundance of caution because there's concentric circles, right? So without getting too much into conversations between leaders, I did some television about Casey Hickok at the time that Casey Hickok was in a tent. Casey Hickok is a nurse who was stuck in a tent up here, and was able to have a good discussion with Governor Christie, and I think he made the right decision in letting her go. But the concern of Casey Hickok and the concern of the privacy for these doctors is if we invade the privacy, or if we quarantine unnecessarily outside the realm of science, doctors who are willing to treat Ebola or go overseas to fight Ebola, then there are less people that are able to do that. If I'm a doctor and I've got 2 months to give, but with the quarantine you take me away from making money for 4 months, then maybe I can't make it over. And what ends up happening is you end up having more Ebola, more death, and more chances of visiting your town. So we felt like that was very important. We had one other thing I'll tell you within the zone of privacy, and then I'll take any questions you may have. We had a homeless man who was very unhappy that his name got out there. But we recognized right away with the homeless man, and I told the first responders, these guys are, especially the police guys, are very much, and this is for anybody in public health or anybody in these, you just need to realize this. Think about your first responders. You get a flat tire. Firefighter pulls up behind you. What are you thinking? You're thinking, great, they're going to help me change my tire. Policeman pulls up behind you. What are you thinking? And I can say this because I'm from a police family. I got a badge. What are you thinking? You're thinking, what did I do? I just had a flat tire, right? So the police are always like, let's get these guys and secure them, and we'll put them in jail in an infirmary, right? Well, that's exactly the wrong thing to do, right? Because this homeless person had some issues that caused him to be homeless, and if it's very likely that Ebola or some other communicable disease would spread amongst people who are without a home and are harder to find. And if not in Dallas, perhaps in Cincinnati or New York or Washington, D.C. And so the way we treat this person is going to have a ramification on a disease outbreak that could happen somewhere else. So we found the person, put them in a hotel. That didn't work out too well because of the press. Eventually shut down a wing of the Presbyterian Hospital, the place where the Ebola outbreak was treated. And they had their own wing of the hospital for a time, and just tried to treat everybody the way that we would want our own families treated. And I think by doing that, people were able to come forward. There was a time, which I didn't necessarily agree with, but it was another time when we had to, work with everyone. The city of Dallas was very upset when they found out that Amber Vinson flew in an airplane. I don't know if you remember this, but we had a nurse that flew in an airplane. I was very upset by that as well. And so they wanted some restrictions on our healthcare professionals. And the professionals were upset about those restrictions, understandably. These are about 70 people who had treated the folks. But because they knew we were in their corner, and because they'd seen others treated with respect, we were able to have a meeting. It was a tearful meeting. I had doctors and nurses, crying in the meeting. But they rallied together. I think one important thing to remember when you're dealing with healthcare professionals is they don't need to be treated like suspects. They need to be treated like people who have made a career decision to give their lives to helping other people. And they really stepped up and followed these protocols so that they would come into the hospital twice a day, or at least once a day at home on Skype. They'd take their own temperature, and then once a day they would come in to take their temperature at the hospital. I ended up moving my EOC to the hospital when the nurses got sick, and so they would come in to take their temperature across from my office, and I always left the door open at that time so anyone could come in and talk about what was going on, because there were some very bad things that happened to their children and whatnot through this. And but we treated everyone like we would want to be treated, got through it, and kept everyone's privacy relatively intact. I'm sure there are things we could do better, and I'm open for questions or suggestions on what those would be.
Do y'all have some questions?
So, yes, sir.
Hi, Adrian Groffer, Commission on Privacy Rights. That's a very, very interesting and moving. Thank you very much for being so clear. You were put in a role of making privacy decisions, privacy czar or whatever, for that period of time. And the question I would have is, and you made a point about local control and trust in that context, do you see, to the extent that we are going to have a privacy infrastructure, not necessarily European style, but the way they're trying to do it in the EU, do you imagine that we could have that kind of role at a local or at a community level, that there could be a privacy officer within, not necessarily a county level, but at some relatively local level, rather than thinking of that role, which you played temporarily, being a federal or national scale role?
I think the closer you get government to the people, the better chance you have of government working. The thing that in this last legislative session in Texas, there was a move to take public health away from my position and put it in the governor's position. And that bill failed. I'm a Democrat. The legislature is 2/3 Republican. And despite that fact, and despite the governor thinking it was very important to put it on his agenda, both houses of the legislature killed the bill. And I think they did that because what they recognize is if people's rights are not protected at the local level, you can fire your mayor or your county judge. You can't fire a person in a state agency with your votes in your little county or city. You certainly can't fire a person in a federal agency in Washington with your little county or your little city in Texas or Delaware or wherever you are. And so government is most responsive when it's at the local level. And so I would definitely be in favor of us having those all the way down. A federal privacy office, state privacy offices, and some local privacy office that answer to people that voters can fire.
Hi, thank you. Oh. Thank you so much. I was wondering, and maybe, Deborah, you said this in your intro, but I think I walked in just after that, but how did Mr. Duncan's name first get get out, like the original privacy whatever leak? And then is there anything you want to talk about just about subsequent to those events? There were some federal, I think federally led, and then states could exceed them, restrictions, quarantine, and monitoring of the health workers returning, or actually anyone flying in from the 3 most affected West African countries. So I just thought you might want to talk about those as well.
Okay. So the first question, the hospital released the name. Someone at the hospital released the name. I think if you, for the first 40 hours of this outbreak, I was unable to do any press or talk to anyone because I was in the EOC. I asked my friend and partner in all this, the mayor of Dallas, Mike Rawlings, to do that. If you notice Mike's comments for those first 40 hours, he referred to them as patient 0. And then after I was able to do press for about the next 20 hours, I referred to them as patient 0. And that was intentional because we were upset that his name was released. Mm-hmm. After that, I began to referring to him as Eric Duncan as he was taking a turn for the worse, and I got to know Louise and see the humanity. I never got a chance to meet Mr. Duncan, but see the humanity in the person, and because it was nationally reported, referring to him by name. The protocols at the airports have been changed. That was a question. The second one was airport protocols. I'm sorry, go ahead, ask that second one.
Once people get home, once they've traveled from one of those countries, they have to either be monitored or in some cases quarantined.
So what we do, we have and we came, helped come up with this in Texas. David Lakey and I pretty much sat down over a cup of coffee and just made this up, and then ran it past some people at the CDC. The CDC's was a little bit more restrictive than ours, and I think now the CDC has kind of gone with that Texas model. But if when I say you, if the healthcare worker or the traveler has a known exposure, like a needle stick, then they are self-quarantined, like Dr. Spencer was up in New York. If it's anything below... Oh, he was not. Well, after he showed symptoms, didn't they self-quarantine him in his house, or was he?
After he showed symptoms, he was sick, and he was treated at Bellevue.
He was treated at Bellevue. Okay. So before symptoms, we self-quarantine those people only. Others are given suggestions about where they can, where it would be more preferable for them to travel and decisions that they need to make. We take their temperature twice. Once by Skype, if they have that capability, and most of them do because they traveled overseas, so they have that ability. If they don't, then we send people to their homes to do it for them twice. And then we send workers out to do it once. We changed our protocol so that it was 101.5 is when you brought someone in for a test. Ours is now... we found Amber and Nina at 99.5, and that was David's idea to do that. And it really helps to get it that early when the disease load is down. And so we continue to do that. Today we have people who we are monitoring, I think 2 or 3 who we are monitoring in the area because with 7 million people, effectively, Dallas County also does the monitoring for everybody in the 7 million people. Sometimes Tarrant County will do a little bit, which is where Fort Worth is, but mostly it's up to us to do it. So that's been done. At the airports, there's a little bit of a check, but that's a bit of a vulnerability that we still have. So does that answer your question? Or okay.
Other questions?
And we don't, by the way, we do not release anyone's health information. The New York Times and Dallas Morning News just reported that they found out about 12 people that were hospitalized for a series of days with this that the news didn't know about. There's actually more that the news doesn't know about. But there was no reason for them to know that.
Right.
Because these people didn't have Ebola. Yes, sir.
Excuse me, Bill Yasnoff, Health IT Consultant. You mentioned that there really wasn't a playbook for you in the Emergency Operations Center to deal with Ebola. So, and you had to develop one. Now that you've done that, have you codified that? Is it available to other people? How is it being disseminated? So is there a mechanism so that next time this happens, someone like you will have more guidance?
It's partially codified. Harvard had just released a study on the disease tracing aspect of it. DARPA is looking at some things on it. There's some various recommendations. There's been what's called a hot wash, which is right after it happens, after action. But the full after action hasn't been done. I think a lot of what we learned at it's been, well, yes, it has been codified and is in the process of being improved. That's what I should say, because they used it in New York and New Jersey and a couple of other places that turned out to be negatives. They went ahead and opened up an EOC and opened that box up. But it's not as complete as I'd like to see it. So,
I'd like to ask one question.
yeah.
In future Ebola epidemics, are all the patients' names going to come out? Like, it seems like they have with the few people that came over, you know, in New York and so forth. The names, shouldn't that be, isn't that a principle of public health with infectious diseases that are, is to try to keep the restrictions? And I understand how difficult it is in a hospital when typically all of the nurses, all of the physicians, virtually all of the clinical staff and sometimes administrative staff all have access to all the patient data. So it's easy to understand how it could have leaked.
Sure. It's almost impossible. I think the answer to that when it's healthcare workers is, as a practical matter, yes, it will. Because it's almost impossible, or might be truly impossible, to keep that a secret. Okay. Given that, you take the situation with Eric Duncan, you had 72 people that were in and out of his room, right? They all know each other. They work together. They're allies with one another. When one of them goes into the hospital, they all know it. And then their significant others know it, and so on and so on. So it's almost impossible. With Nina Pham, I remember with Nina, they called me, I think it was 11:30, and I was just about to go to sleep. And they said, we have a positive, it's a nurse. And so I said, well, I'll be there in about 30 minutes. And so I called Mike Rawlings, who's our mayor of Dallas, and said, I'm going to go up there. You know, this is what happened. He said, do you want some company? And I said, yeah, I guess so. And so he had, you know, we worked very closely together, as I said. So he called my chief of staff. I'm going up there just to kind of see what's going on, calm down the folks there. I mean, it was kind of a shock for everyone at the hospital. He came in with my chief of staff and his chief of staff, and we wrote out what we would tell the public the next morning. I was there when they told Nina, and I could hear her response. You know, I was close enough in a different room, but close enough to hear, you know, her shock and hearing that, and her parents. And so about 4 o'clock in the morning, I said to Mike, I think I need to go talk to these parents now. And so I walked around with the head of emergency medicine and looked at what was going on, tried to kind of gauge the level of fight and shock left in the medical team there, given that one of their own was sick. And so I went to talk to the parents, and they were comfortable, made sure that they were comfortable. Here's what we're planning on doing at you know, 7 o'clock local time. We'll, you know, explain this to the public. Are you comfortable with your daughter's, you know, name being used? Yes, you know, we are. So didn't find it out from Nina, but you know, found that out from them. We still didn't use their daughter's name, I don't think, that morning. The press found it out anyway. With Amber, I didn't have the opportunity to have that conversation with her because by the time her plane landed, the news already had that. But we tried our best to, you know, keep those things private. I will say that, I don't want to speak about lawsuits, but these two nurses were heroic people. I talked to them pretty regularly while they were fighting for their lives on Skype. I think some of the news of Nina being more concerned about her dog than herself, probably, as people have heard those stories. But it was a time when, their privacy was, very precious to them, and they did not want to be, filmed. When I give talks now, there is one picture when I use it with Amber's permission. Amber is the nurse that flew. Mm-hmm. And it's a picture that someone took of Amber in her hospital bed, and I believe she was, after she'd left Dallas. And I say this is, a picture of what, Grace under pressure looks like, because she's, smiling, has a brave face, and, you feel incredibly close to all of them. Amber and her husband texted me from their honeymoon suite, and I texted them back, this is not what you're supposed to be doing right now. But, just feel an incredible closeness to them. Feel very honored that I was able to, be a part of what we went through with them, because they're all exceptional people. And I think the people at the hospital, the doctors who were treating and the nurses and the people in the C-suite at the hospital, we're all very much trying to do their best. I think it's impossible to do things perfectly, and I'm sure we all have things that we would do differently. But what I tried to encourage people at the time of Ebola, and even now when we deal with these aftermath of these privacy situations that were not ideal that came from that outbreak, the villain in the outbreak is Ebola. The villain in the outbreak is not the hospital, not anybody, not Eric Duncan. If you want to get mad at somebody, get mad at Ebola, but don't get mad at the people that they were doing the best that they could. Yes, ma'am.
Yes, I wanted to thank you for coming. I'm Lily Coney. I work for Congresswoman Jackson Lee, but I also am a good friend of Deborah Peel, who's worked with patient privacy for a number of years. And your grace, I'm from Beaumont, Texas, so
she's
I know about.
She was Jackson
right?
Lee.
Yeah.
I knew she was a Texan.
But your grace and your calmness, I think, was something that struck me, because you weren't planning to be in the middle of a media storm with a crisis, with something that you only saw in maybe movies, versus what you went through and what you learned. The thing that I've noted about government is that you can do drills and practices and all of these things, but they remain pretty much in people's heads and in a binder that goes on the shelf. From your experiences, have you thought about helping to develop drills or step-through plans that others who may be in your situation can sort of begin to think about? Because the situation with Ebola it's a highly contagious disease, which is something that can occur whether it's an H1N1 outbreak of some type or some other kind of emergency, to deal with not just the patients, but the medical staff, the importance of privacy, the importance of the things that you did in order to maintain as much focus by the people who needed to be on point, the first responders. Have you been approached to do anything like that to help others try to plan in advance what they would do if they're faced with similar circumstance?
Yes, I have. In fact, I just did one for all the emergency managers with the state of Texas, with TCQ, mostly involving like a fracking emergency or other things, but training about leadership in those situations on Tuesday. And for those who aren't Texans, TCQ is the Texas Commission on Environmental Quality that deals with earthquakes and fracking and oil spills and things that train derailments.
In Texas.
These sorts of matters. I have spoken in other states about this, and my top emergency manager, who served as the incident commander, sitting at the front of the table executing. If we said hire a cleaning crew to clean up this house and move these people, he would execute that. And so, although I'm not able to go as many times, I know he's been to Oregon, Maryland, Quantico, some other Florida. I think he's going to North Carolina in a couple of weeks. So we are doing that. Let me say one thing about Congressman Sheila Jackson Lee, since you work for Sheila Jackson Lee. This somewhat unrelated matter that we did, there were some children that were stuck on our border from other countries, and we offered to house 2,000 of them in Dallas County. Mm-hmm. And it was intensely disliked by a lot of people that were picketing in my yard and all sorts of foolishness. I went down to the border to see the children, and that day with the chairman of the Homeland Security Committee, Brian McCall, and a whole group of others, and Sheila Jackson Lee was there. She was the first, had members of Congress saying, you're going to be accused of being, well, all sorts of bad things. She was the first member of Congress to show support and help change the tide. President Obama credited the people, not me, but the people of North Texas for changing the conversation from some security and disease threat on the border to children made in the image of God who needed help. And Sheila Jackson Lee was a huge help in that. She changed that conversation in Houston, which is the Houston metro area, which is the second largest metro area in Texas. So she's a hero of mine. I appreciate you being here.
Well, if there are no more questions, I think the judge may have to catch a flight.
Gotta.
Is that right? Nobody else? Or we're just in awe? Isn't he amazing? He's amazing.
Thank you very much. Thank you all.
Thank you so much.
Thank you so much.